who are planning to choose pediatrics as their specialty, how would you describe the pros and cons of this branch?
Obviously, you have to have a lot of patience. So patience is very, very important.
So do you think pediatrics in a whole is a toxic department?
Yes, might happen where number of people handling the department are less, because
A normal faint-hearted person can actually handle that. You have to be very strong-willed to bear that complete scenario.
one of the biggest challenge was that even finer details which a doctor might miss, a pediatrician should not miss, because
If a new MBBS student, wants to judge an institute or a college or a hospital, what should be the parameters that he or she should be looking for?
the most important parameter is not to judge based upon the college, the teaching, to judge based upon the attendance, how many patients.
If he is not getting medicine, he tends to choose pediatrics. Why is that so?
Is not everyone's cup of tea. So that is why I possibly feel that pediatrics is very challenging.
Sir, how much does a pediatrician earn in our country? We are on a mission to build India's largest community of medicos, and I want you to be a part of it. Each one of you can help me build this mission. Guys, today on our podcast, we have got a very special guest. And yes, it is based upon your request only. Pediatrics. I think this is one of the very special branches, and we have so much to explore. And for that, to guide us, to help us, I have got a pediatrician, a practicing pediatrician. He is also a medical educator with over 15 years of experience. He is a faculty. He has taught, a very high number of students in NEET PG, FMGE, INICT. He's an author himself. He has written the book Complete Pediatrics with Dr. Dhulika. He is none other than Dr. Pankaj Tikku, sir. I have known him for many years. He has been a mentor, a very dear friend, and a brilliant pediatrician. Who better to guide us than the brilliant man himself? So let's put our hands together, and with a huge round of applause, let's welcome Dr. Pankaj Tikku, sir. So thank you so much for taking out time for our show.
Thank you, Dr. Nachiket. Thank you for reaching out, and thank you for inviting me to this podcast. Hope we'll have a good time.
Sir, we will be having an amazing time. I think pediatrics as a branch, I think our audience is dying to know more about this. And who better to guide them than you? So you're having so much experience as a practitioner, as a faculty, and you have seen the branch up close. So sir, before we get on to that journey, I would request you that we want to know in detail, how did Dr. Pankaj Tikku, sir, start his journey as an MBBS, MD, and his further life?
So I did my schooling part from St. Michael's, and then the incident was really funny. My father was like the incident in the sense, my father was admitted in the hospital. He got well, but while I was there in the hospital, BL Kapoor, at that time I was in 12th, and I saw my doctor, my father's doctor, physician, moving out with 3-4 junior doctors, all towing him and moving behind him. And that was for the first time I realized how a doctor should look like. And I think by 11th I'd already started thinking of being a doctor, but that was what actually completely solidified the fact that I should be a doctor. Then I cleared my PMT, did my graduation from University College of Medical Sciences. After that, pediatrics was something which was very close to my heart, and did my post-graduation from Lady Hardinge Medical College. Pediatrics was something which I always wanted to do. There were many reasons for that. I'd somewhere seen once that good pediatricians are very hard to find, but very impossible to forget. So that was something which made me believe that pediatrics is the line that I want. Plus, there was definitely a love for children. I mean, a lot of love for children. And that is why I chose pediatrics. After that, the journey has been, thankfully, very smooth. There are highs and lows, but then thankfully, the journey after that, being in pediatric practice, has been smooth.
That's great to know, sir. I think I can't imagine somebody being a better pediatrician than you, because you have always been somebody who's very calm, very gentle, and I don't think so I have ever seen you angry, and I've worked with you for more than 8 to 9 years now. So I think you have all the best qualities to become a pediatrician. But so I would again ask you, why did you choose pediatrics as your specialty?
See, definitely the first thing was the love for children. I mean, I always want to be surrounded by children. And plus, I told you the saying that I saw, which somewhere had an impact. And the most important thing at that point of time was that by being into pediatric practice, I thought I'll be, fulfilling many challenges. One of the biggest challenge was that even finer details which a doctor might miss, a pediatrician should not miss, because you don't get those history takings in a child. So that was really very challenging. And during my MBBS time, I always found this very challenging, that you should not miss small details. A child just touching his ear might be a sign of otitis media, ear infection. A child having recurrent crying during the time of passing urine may be a sign of UTI. So that was very challenging to me, because people tell their complaints. A child will not be able to tell his complaints. So that is where I thought that, yes, why not pediatrics? Surgical branches I never wanted, because I was never good in those finer things. But yes, among the medical branches, pediatrics is what I thought I would take, and thankfully I got it.
So for our NEET PG students who are planning to choose pediatrics as their specialty, how would you describe the pros and cons of this branch?
See, pediatrics, there are many pros. One of the pros I've already told you is that if you like being in the vicinity of children, if you like children, this is the best branch. I mean, the best souls in this world, and there can never be a person who won't like those souls. I mean, you can get angry with anyone, but you will never get angry with children. So if you like children, there is no better branch than this. Second, obviously, is the trust. All doctors want their patients should have trust. But a pediatrician will get the trust from a mother. And if you like that feeling of someone saying that I've come 20 kilometers or 30 kilometers from a far off place just to meet you and show my child to you, or a mother who probably will wait for 1 or 2 days to show her child to you just because you were not there at that time, you were on a vacation or probably not available. She might spend 2 days and then show the child when you are back. That is something which always gives you a high. I mean, we always thought, I've always heard this, that my senior resident told me this once, that all other specialties, they treat one patient at one single time. Pediatricians treat 2 patients at one single time. One is the child, one is the mother of the child. So, the mother is so much trusting you that she probably will travel miles to show a child to you, and there is no better place than this. The third, obviously, a very important pro of pediatrics is money part. Money part is definitely good. It may not be the best, but it is very good. So you are likely to have so many things which can probably help you out in that money part. Cons part is that obviously you have to have a lot of patience. You don't get easy history from the child. So patience is very, very important. And if you don't have patience, don't take pediatrics, definitely. If you get angry very quickly, if you lose patience very quickly, this is not the place for you. The second very important thing is lifestyle. It is hectic. But I always say that hectic lifestyle should not be a reason for you to not to take pediatrics. On a lighter vein, I heard somewhere that if you have problems in your personal life, become a pediatrician, because neither will there be a personal life nor there will be any problems. But that is again on a lighter vein. See, I see it this way, ki if you think of becoming a pilot and tomorrow you fear flying, doesn't make sense. Why did you? So I don't think anyone in this world thinks that after taking medicine, I'll have a very lovely lifestyle and a lot of time. So if you have chosen medicine and later on you think of choosing pediatrics, think of it that you'll have a hectic lifestyle, but all of that gets settled up eventually. So it is not like this should be a strict disadvantage or a downside of taking pediatrics, but yes, there is definitely a hectic lifestyle. Third, obviously, I should not say this directly, but indirectly, yes, because of the child being the so valuable person in the family, emotions can run high. Situations in certain cases in your clinics can become obnoxious, can become difficult. So if you have that fear in your mind, again, don't take pediatrics. But again, this is something which should not be a reason for not taking pediatrics. slightly longer time before the mother and father gets trust in you, so you don't start earning immediately the day you enter into your practice. You do get a good living. You are able to maintain a good lifestyle after practice also, after SRship also, but it takes time. There are some specialities, I believe, derma, psyche, in which you can start earning very well immediately after. Here you will have a window period, but soon you start earning very well. So these are a few downsides I feel, which many of which can easily be overcome if you are a diehard fan of pediatrics.
I think, sir, it's a beautifully consolidated statement that you have given us, and I do agree with the emotional part actually. Recently, due to some family instances, I had to be in the pediatrics ward, and I realized that it's very different just to be there. When a child is crying, especially a newborn baby, at that particular moment, if something happens to him or her, I don't think so a normal faint-hearted person can actually handle that. You have to be very strong-willed and very strong-hearted to bear that complete scenario. So pediatrics is for the strong-hearted.
Strong-hearted.
So thank you so much for that. Sir, you just told me that the personal life is a little bit less. So how would you completely describe the work-life balance in pediatrics?
See, as I said, once you have taken medicine, you should be ready for personal life getting affected. There are few specialities in which it may not be that affected, but otherwise it does get affected. Most of the emergency calls are at night. You have to many times attend the emergencies at night. So makes sense that if you do not want to your personal life to get affected, makes sense not to take pediatrics. But as I said, these are problems which you should be prepared for, and I think does happen in the immediate 5 years post SRship period or 10 years post. But eventually, as you become more and more senior, you become an associate professor or a senior consultant. You have a team to look up to the night emergencies. You are on calls. But I think the team may be very, for example, most of the big hospitals, they have a very capable team of senior residents who can handle night emergencies. You might be called once in a while on a call day, but does not happen very frequently. So whatever problems related to hectic lifestyle are there, I think happens for around 5 to 10 years max after completing your SRship. But once you are 40 plus, things start settling down.
So if a new student, if a new MBBS student, wants to judge an institute or a college or a hospital, whether this is good for pediatrics or not, what should be the parameters that he or she should be looking for?
That's a very good question, Dr. Nachiket, because this is a question that has been asked by many students in my classes. So I always think the most important parameter is not to judge based upon the college, the teaching, to judge based upon the attendance, how many patient footfall is there in the hospital. I personally feel there is a strong thought process at this point of time that students tend to go by the colleges. For example, a teaching college may be very good. I would not like to name here in Delhi, all colleges are good, but there are few colleges in which the teaching is very good. There are few hospitals in which the footfall is very high. The teaching may not be that good, but the teaching is not that good possibly because of the fact again that the footfall is so high. So every faculty in the department is busy because they are ultimately sitting in the OPDs and managing the emergencies also. So given the fact that I have a comparison between these two, I'll always advise the students to take the place where the footfall is very high, because ultimately in post-graduation you are not studying, you actually are seeing the patient. We had this I would say a blessing of seeing so many patients in Harding, so many, and average emergency day there used to be scores of children coming in. So you had an experience of seeing all type of problems that commonly we do not see in a day-to-day practice. In day-to-day practice, we are dealing with diarrheas, vomitings, abdominal pain. But when it comes to hospitals where the footfalls are very high, you are able to see those type of problems, which neurological problems, DMDs, skeletal muscle problems, then even cardiac problems, which will not be seen in other hospitals where the number of patients are less. So I would advise not to go by where teaching is very good. Teaching is till graduation. Post-graduation is experience. How many patients you are seeing. Your SRs are always there sitting right across you in the OPDs. When we used to sit in the OPDs as PGs, our SRs were across you. So our teaching was coming from the SRs only. I was seeing a patient, I was asking him, sir, what is this? I'm seeing this type of a patch here. And he would immediately say, okay, this patch is this. So, I mean, your teacher, you do not require a separate. We were being taught also, every, I think, second or third day, there used to be classes also there. One of the senior faculties used to take the classes. Case discussions used to be there. But strictly this, according to me, is not the criteria for taking pediatrics. Take pediatrics from a hospital or a college. Just inquire about the footfall, the number of patients attending that hospital. And if that patients attending the hospital is Safdarjung, for example, huge footfall. So I'm not sure about the college, how good the college is, but given the footfall, the number of patients attending Safdarjung, excellent place to do MD pediatrics from. So according to me, the most important criteria should be how many patients are attending the hospital. You are seeing the patients, your SR is sitting opposite you, teaching is happening. There is no need for separate teachings, no need for case discussions. Case discussions are happening, very good. But your day-to-day teaching is happening with the SRs sitting across you.
Great, sir. Thank you so much. So currently, do you count MD Pediatrics and DNB Pediatrics as equal? Is there any difference? And if there is, then what is that difference?
See, again, depends upon what your future goal is. If your future goal is to be a faculty, teaching faculty in a big college, MD is important. But if your future goal, and that is what I'm seeing, most people who are now passing out, their future goal is finally seeing patients, children. So there I feel doing a DNB from a good institute is equivalent to an MD pediatrics. So it doesn't make sense that you run only after MD pediatrics. You're getting MD pediatrics, take it, obviously. But if you're not getting an MD pediatrics, doing a DNB pediatrics from a good institute, I think is worth it. So MD pediatrics from a good college, take it. MD pediatrics from a place where patients negligible, but DNB get pediatrics from a place where patients footfall again high, take DNB Pediatrics. This is my personal opinion.
That's great, sir. So can you name top 5 institutes for MD Pediatrics in India?
So I think AIMS obviously is very good. Then we have Lady Harding, very good. Maulana Azad is good. Then DY Patil Hospital, I have heard of, is very good. Then CMC, Vellore, very good. KMC, Kasturba Medical College, very good.
So top 5 institutes for DNB Pediatrics in India.
St. Stephen's is good. Then KM is very good. Then Gangaram Hospital, definitely very good. And DNB courses in Gangaram, especially pediatric courses, are real good. St. John's is very good. So St. John's, KEM, Grants Medical College is good. And Stephen's and Gangaram, I would say, are good.
So what do you think will be the 10-year future for pediatrics as a branch?
See, 10-year future, I would always say is wonderful. We'll never run short of patients. Not that we want children to be patients, but seeing the population in India, you'll never run out of patients. Having said that, obviously, what I feel is that I have overall seen there is slightly lesser amount of training in many medical colleges that are being important. In some medical colleges that are being important for in MD pediatrics, which I feel the training should slightly improve to the fact that we should have more and more procedures that are usually done in children, which should be shown to the young pediatric graduates also, and also they should be, doing all of these. There are instances where I've heard that people who have done MD pediatrics from particular institutes were not given the chance to even perform those procedures in children. So if that is done and the training imparted is proper, and it is not happening everywhere, but in some colleges. So if the structured flow is there, as has always been provided in medical pediatric curriculum, I think we have a wonderful future. And you can see most of the houses now have at least 2 kids. So you'll never be short of patients. Again, I'm not saying that we want children to be patients. They are the cutest souls. But ultimately, our job is to see children. So we'll never run out of patients. So I definitely feel it's a very, very good future.
So what do you think is the future potentials and possibilities for an MD pediatrician?
In the past, MD Pediatrics was more or less an end branch. So after being an MD Pediatrics, you enter into practice. Now we have so many DM programs. They are fellowship programs. DM programs, for example, are again both 3-year DM programs, and there are many now 6-year post MBBS courses also which are available. So we have now many big institutes offering DM neonatology, pediatric cardiology. There are many people who are now taking pediatric cardiology. Heart diseases in children are on the rise. So pediatric cardiology, that many people now are opting for pediatric neurology, because again neurological problems in children are on the rise. And then we have clinical hematology, again pediatric clinical hematology, then pediatric gastroenterology. Critical care medicine is something which is now many pediatricians are opting for it. Intensivist, becoming pediatric intensivist. One thing that I always wanted to be in the past, but couldn't take it. But pediatric intensive training is something, again, seeing those cute children in ICUs, no one wants to do that. But I have heard of statistics that in the past, neonatal ICU admissions used to be around 15 to 20%, which have risen to almost around 40 to 50% in many centers. Neonatal ICUs, we are having much better neonatal ICUs than what used to be in the past. Digital videoscopies and then minimal invasive surgeries have now come in. And I think we are now in a much better place to be able to treat neonatal emergencies. So neonatal intensive care is on the rise. So I think this is again a branch that people can take. Pediatric surgery. After MBBS, many people are now opting for a 6-year. I think we have a 6-year course also in pediatric surgery. Many surgeons after doing surgery are taking a MCH 3 years course. We have even DNB pediatric surgery course. So pediatric surgery again is something which is being a sought after field. Was not in the past, but things are again changing. Again, because of the fact that we have become so advanced that we have much better chances to treat congenital problems in children, which were not problem in the past. In the past, many times congenital problems were like end, but now there are so many congenital problems. Anorectal malformations, heart diseases, congenital heart diseases used to be dreadful in the past, but outcomes of so many congenital heart diseases have changed. We have so many good pediatric cardiologists who are now available. And interventional radiology is also now taking a part in improving the pediatric surgical scenario in India. So I think the future is very good after doing MD Pediatrics, and there are so many specialties to branch out into.
So out of all these branches that you have just described, which one do you think will have the highest potential in the next 10 years?
I foresee pediatric cardiology.
Pediatric cardiology. Yeah. Hands-on.
Definitely. Something which, I mean, great respect for them.
Great, sir. So what are the possibilities and potentials of MD Pediatrician outside our country?
See, outside the country, again, I would say in UAE, I think they do accept now MD Pediatrics as one of the, I'm not very sure, but I think they do accept this as one of the recognized branches. Then PLAB and USMLE are always there. We have a lot of people who are going out of India after MBBS and taking pediatric cardiology courses in UK also, in the US also. So even after doing MBBS, if you want to take a pediatric branch, I think it's very good. After doing MD Pediatrics, again, it is very good. But I would still say that options in India are opening up so much for an MD pediatrician that if you have an opportunity to stay here and start seeing children. In the past, yes, I understand neonatal ICUs were not very well equipped, but things have changed now. So outside also opportunities are very good. India also the opportunities are becoming better.
So now we come to the most demanded question for our podcast. So how much does a pediatrician earn in our country?
See, an SR from a good institute, a private institute, again, I'm talking about a good 3-tier institute, a institute which is in a big city, should be getting somewhere around 18 to 24 lakhs per month. When you move on after SRship, you start earning somewhere between, I would say, 30 to 36, 40, many times 48 also. Depends again from place to place, which place you are. And good pediatricians, after a decent amount of experience, are definitely capable of earning 65, 70 plus more. And if you are working in a prime hospital and you have been there for a very long time, more than 1 CR, easily acceptable, because again, it is all about trust.
So many a times I have also heard from students itself that they do not find pediatrics as glamorous as medicine or surgery or gynecology. They feel that this branch might not have that kind of glamour or the financial reward. I think financial reward, you have clearly said it is there. But do you think that this branch lacks glamour? Why is it mostly it is a second choice for a person who's considering medicine? If he is not getting medicine, he tends to choose pediatrics. Why is that so?
See, my personal opinion is, again, because of the fact that so much of patience that is required in this field is not everyone's cup of tea. So many people are afraid even having a newborn in their hand. You hand over a newborn to a person and his hands will be trembling. So one of the things that I have seen many of my contemporaries, many of my colleagues disliked about pediatrics possibly was that they never had that much of patience, that they should spend 45 minutes to an hour. Sometimes an average OPD duration with one child can run to almost around 45 minutes to 1 hour. So if I'm seeing my patients from morning to evening, spending 1 hour on one patient means I'm hardly seeing around 10-15 patients in a day, which is something which many people do not like. So that possibly might be one of the reasons why it is perceived as a second branch to medicine. But I would still say children are future adults. So, whatever adults become in the future, the children are sort of primitive adults. So most of the problems are there in adults are the problems that happen in children, but they need to be treated differently. So I personally feel, I may be wrong also, what a physician can do, many pediatricians can do, but what a pediatrician can do, many physicians may not be able to do. Drug dosages, for example, many physicians are not, and I get many patients sometimes who are wrongly treated or probably improperly treated by some of the physicians. Many of the physicians, they very, very ethically say, no, that this is a young child, I do not know the dose. So most of the physicians do that. But there are some who possibly try to treat, maybe because it was an emergency if they treated, but they are treating the child with possibly doses which are 2 times higher the dose than should be normally given. Similarly, the presentation of many diseases can be very different in an adult. For example, presentation of enteric, typhoid, very different from an adult. Children can present just with diarrheas in typhoid. So presentation is very different. Values of lab reports, very different. So a physician may not be able to interpret. So that is why I possibly feel that pediatrics is very challenging. Possibly the reason why you are saying that it is taken second to medicine is because it is so challenging that people do not deem it to be fit enough to take that challenge. But those who are fit enough to take that challenge enjoy this field.
So what are the business opportunities in this field?
Pediatrics per se?
Yes, sir.
So again, business opportunities in terms of again, you have you can venture into different type of medical article writing also, which is related to pediatrics also. So there are so many pediatric journals, so many pediatric updates. So you can even enter into pediatric medical writing if you want. So writing of medical articles which are related to pediatrics, getting them published in big journals, that is one thing. Then vaccination, I will not say is a business opportunity, but vaccination again is something which as a pediatrician, parents will bring the child to you. So it's not strictly a business opportunity, but vaccination is always a part of pediatrics. Well baby clinics, there are many people who have opened up well baby clinics, especially when your wife is a gynecologist. So what happens is that you have a hospital and you have a wife, a gynecologist, husband is a pediatrician. So no better business opportunity. You can open up full center which can cater to from the time of pregnancy till the time the child is born. And there is nothing wrong because every woman would want that if my child is delivered by a gynecologist, someone who is known to this gynecologist, for example, the husband, should be dealing with the child also. And everything done under one roof gives us sort of trust also to them. So again, if you can associate with a gynecologist, again, a very good business opportunity. Many pediatricians have opened up well baby clinics. So, telling the mother how to breastfeed is something which, because of our day-to-day practice, we are so much consumed in our day-to-day practice, hectic lifestyles. We are not able to tell the mothers properly how to breastfeed. Many mothers, especially first-time babies, they are not able to breastfeed. The baby not getting breastfed properly is the reason why many babies probably develop dehydration, constipation. Just a child not passing stools immediately after birth may not be a pathology. It might be just because the child is not receiving the feeds properly, and that is because the mother is nothing negative about the mother. The mother has never been taught how to properly breastfeed. There is a way of properly breastfeeding the child. When the child is breastfeeding, it's an energy expenditure, so the child goes to sleep. Many mothers perceive it as the child going to sleep during breastfeeding as that the child has a fill, but the child is not. You have to continuously talk to the baby. The baby may not be understanding everything, but baby is hearing you. There is an eye-to-eye contact. You have to tell the mother about this. That is when the baby will be taking feeds properly. Completely empty from one side the breast, then move the child to the next breast. Many mothers are not aware of this. So this whole process, I would say, is a process that you should take some time to tell the mothers about them. So I feel these are very, very important parts, and these are very important accessory parts. So well baby clinics, you tell mothers all about these. You are able to tell the mother, guide the mother about breastfeeding. So many people have opened up these well baby clinics in their hospitals also. So this is getting associated with the gynecologist, even if not your wife, getting associated with the gynecologist, opening up in a center. I've seen many people who are pediatric surgeons have also become associated with these type of associations. And there is nothing wrong. A pediatrician, a pediatric, there are many centers which are providing a complete multidisciplinary approach under one roof. So from the time of pregnancy, child born, child being treated by a pediatrician or being seen by a pediatrician, God forbidding, if the child has a congenital problem, being treated by the pediatric surgeon under the same roof. So a very good business opportunity.
So while we were researching for this particular podcast, we came on a very unique fact. It was that pediatric residents normally have the highest burnout rate, reported at around 40%. So do you think that the emotional trauma that happens with them, we normally tend to overlook it? Because I believe that's on a very heavy side. So what would be your advice to a new JR1 to how to handle that emotions and that sensitiveness of that situation they are normally in?
See, burnout rate, you are absolutely correct. Emotions, as I said during the start of my podcast also, emotions can run very high. And not only the parents, the doctors can also develop a lot of stress, especially seeing a child sinking in front of you. And children deteriorate very fast. You might see the early signs in an adult, but you might miss the signs in a child. So doctors first have to become very hard if they have to be a pediatrician. They should realize, as I said in the beginning again, that you should not miss small opportunities. You should have an observant eye to be able to see everything. So a doctor who misses small things is likely to foresee deterioration in the child and is likely to see then a lot of commotion in the wards, which then again can be very stressful for the doctor and later on lead to burnouts. So I think for young doctors who are pediatricians, I would suggest be compassionate. You have taken this field, as I said, you have taken this field because you want to be in the vicinity of children. If you do not want to be in the vicinity of children, do not take this field. You have taken this field because you like challenges. So if you like challenges, burnout is not something for you. You will face challenges. There is a child sitting in front of you, not able to tell your problems. You have to communicate with him. You have to communicate with the mother. The history that is coming from the mother is not a first-hand history. The mother is not a pediatrician, not a doctor. So she's saying whatever she understands. That history might sometimes be misleading also. You have a problem in the abdomen. The mother perceives that problem, for example, in the ear. So she might be giving you a history somewhere around the ear. So don't be misled. You have to be very observant, seeing the child, and bring on all your experience. At the same time, do not lose your cool. One of the most important reason I think for burnout is doctors start to lose their cool. Do not lose their cool, because the mother is definitely the person who is the closest to the child, but she's not a doctor. She will not be able to probably many times give you a correct history. So do not lose your cool. Stay calm. Be observant for small things. I just told you, just Child again touching the ear is otitis media, ear infection. A child crying during the time of, most children cry before passing urine because they have that distension of the suprapubic area, which makes them a little uncomfortable. So they cry before passing urine, and they cry after passing urine because they are wet, diapers are wet. But a child crying during the passage of urine. So this is something, mother gives you a history. He cries during the passage of urine. This might be a UTI. So child will not say, I am burning. But this, so you have to be very observant. So if you're observant to small things, you have a lot of patience. Having patience is primary. You have to have a lot of patience. Do not get angry on small things. Vent out your anger outside, but not, and child will become very scared if you try to vent out your anger in front of the mother. And child crying, you will not be able to examine the child. No chest examination possible, no abdominal examination possible. So patience again is very important, compassion important, observant to small things important. If you have these things, I think you can definitely reduce the burnout rates.
So I think you were just talking about the communication part between doctor and patient. I have seen personally that currently in India, that is something which is at a very worst situation. I have seen doctor talking to a, concerned parent in too much technical terms and expecting them to understand, and not even taking out time to make them understand that what is actually happening with their kid. And at that time, when the patient's lung was, underinflated, he was having PPTH, he was having VSD, and that too, two VSDs. At that time, the parent was so, confused that what is going to happen. And the doctor was not even taking out time to actually make them understand what is happening. And to me, it was a very unfortunate situation.
Definitely.
All right. Being there, being able to understand a little bit there, then I got a couple of calls done. I could get the real information. But if I totally talk in an unbiased manner, at that time, the patient was being treated unfairly.
Definitely.
He was not being given any kind of time. I believe a reform is required.
Definitely. 100%.
Do you feel so?
Definitely 100%. It's high time that we enter into a scenario where for us just the number of patients is not important. I mean, obviously that is important, but we should give more time to our patients. So making the mother understand, the day you start thinking, till now I was saying it in the lighter side, but the day you start feeling that I'm dealing with two patients one single time, one is the child, the other is the parents, the mother of the child and the father. The day you start taking this seriously, things will start improving. Definitely, as you said correctly, when we are talking about a problem to the parents, we have to understand that they are not doctors. So just telling them your child has 2 VSDs or your child has a VSD, he has a heart disease. The heart disease, the very fact telling the parents of the child, your child has a heart disease, make the parents sink. I mean, their child is already sick and parents' half life is gone because there is a child who has been labeled as a heart disease. And there are many heart diseases, for example, VSDs, which disappear on their own, can be a VSD which disappears on its own in later life. So everything does not need to be told, I think, in a blunt manner. You need to convey the reality to the parents, definitely. No, do not hide. But there is a way when you are communicating. And definitely, yes, the way you communicate a disease to an adult, in case a physician has to be very different from the way you are telling about the disease to the mother of a child or father of a child. Because they have a child who is sick and the parents are, I mean, if not physically sick, mentally sick because of the child being sick. So you have to show passion. And that is what I'm trying to say. Start spending more time with your patients, with the mother who is coming, with the father who is coming with their child. Many times we are in a rush. I have 20 patients outside in the waiting room. I want to finish it because I also have a family. No, you are also dealing with another family who is coming in. As I said, mother does not know anything about how to breastfeed the baby. It's a first baby. Doesn't know how to breastfeed the baby. You just prescribed some medicines, you just gave a BCG vaccine to the child and finished, next patient. No, that is not the way. If you do not tell the mother how to properly breastfeed the baby, if you do not tell the mother what problems the child is having, putting the child on cow's milk for very early life will predispose the child to constipations. Constipations for long periods of time can make the child very uncomfortable. He'll start missing schools. So, I mean, it's a problem that will keep on lingering for a long time. Or it could have been very easily solved if it could have just spent some time to tell the mother, about what problems you are likely to have. Aajkal, what is happening these days is that doctors obviously are having so many patients, but what is also happening these days is that parents are also, so much into their hectic lifestyle. I have many patients in whom the child is brought to me by parents. One is a father is a CEO in some company. Mother is also a person who is in the management some company. So a lot of money. But when it comes to spending time with the children, I heard somewhere that the problems start happening in a child when you replace your presence with presents. So the day you stop giving your presence to a child and you start replacing them with monetary presents, problems will start. House helps will not be able to handle everything. Parents are required. But आजकल क्या हो रहा है? Parents, one child has parents, and if you have two child, you become a referee. घर में जो है वो हंगामा चल रहा है, and the parents are, so many things. I get many times, I had a patient where there was paracetamol poisoning, crocin overdose, just because the parents were busy and crocin was kept open and the child drank the whole bottle of crocin. Could have been very easily solved if the parents would have been giving a little more time with the child. But that is definitely not happening. And two kids are there, fighting is happening, injuries are happening. Silence is golden, but when silence happens in a family with children, silence can be suspicious.
I think, sir, in the field of pediatrics, I think Google is the biggest enemy.
Biggest enemy, definitely.
Because concerned parents tend to Google every single thing, every small thing, and then they tend to make a chaos out of it.
And when the problem has started happening, that is when the child is brought to us. This is again one of the downsides of pediatrics. Many times what happens is awareness is increasing, but many times what happens is, not in our practice, but I think in practice where small cities are involved, parents still take their young children first to maybe a GP, and the GP, if he is not ethically correct, he will not send the child directly to a pediatrician. He'll try something himself. And most of the GPs I've seen, many GPs in smaller cities, let me not say a GP, let me say many quacks, they probably overdose the child with the drugs because they do not know the drug dosages themselves. So ultimately, when the child is coming to us, the child is coming to us with the, overdosage of a drug. And because of the overdosage of drug, he had one problem and now he has started developing 2 or 3 problems. So this Google is something again for, we call them as e-patients. So these are now e-patients that we are getting, parents trying to, but thankfully this awareness is now increasing that children is very important and that treatment has to be done by people who are only dealing with children. So go to a pediatrician, and definitely through this podcast of yours, I would definitely try to again send this message. Children should be treated by pediatricians only, because pediatricians have spent good time learning about children, treating children. So do not take your child. Child is very, very precious. Do not take your child to a doctor who is not specialized in pediatric medicine.
So I think that's a message well received, because I don't think that, in the upcoming generation, parents are ready to take even a single bit of risk with their child.
Definitely.
I think the preciousness is increasing every day, because I have seen in the tier 1 cities, in the corporates, pregnancies are becoming late. Pregnancies are, of course, hectic. Mom, dad are both working. So that one child becomes their most precious gift. And yes, their presence is replaced by presence. But whatever money is required to make the child healthier, stay fit, or just have the best of everything, they are ready to spend it. So I think that that caution, if it is taken care, can actually be a great help to all the pediatricians.
Definitely.
Let's not take a risk. Let's make sure that the person is a pediatrician.
Definitely. This message should go loud and clear through this podcast, that get your child treated with a pediatrician only.
So moving a little away from pediatrics now. So you have been a faculty, you have been a practicing pediatrician, you have seen the whole industry, the whole medical world very closely. So which do you think actually will be the top 5 specialties in the upcoming 10 years?
I feel again, obviously because I love pediatrics for me will always be great. And obviously things with pediatrics look very good in the next 10 years also. So I would definitely still continue to say that pediatrics is a very good field to take if you have a love for children, and obviously if you have that amount of patience. Then moving forward.
So would you say pediatrics or pediatric cardiology?
Again, pediatric cardiology is very good, but again, there are other pediatric specialties. So if you are asking about pediatric super specialty other than pediatrics, I would say pediatric surgery again is very good. If you have that eye for doing surgery, please take pediatric surgery. Congenital problems are being treated now, which were obviously very difficult to treat in the past. And we have very, very good now setups which are available. And so pediatric surgery again is one of them. So I would say pediatrics is one. Pathology I would say is another one, because usme bhi aage fields, there are many fields which you can choose. Then I would say cardiology again is one of them, where even if not pediatric cardiology, cardiology per se is good. Dermatology, lot of scope in dermatology I would say. And I would go in for psychiatry also. Mental health problems are rising. So psychiatry again is one field which will help you maintain that work and life balance also. Derma, psychiatry are very good in this respect, because they will help you maintain both, and plus you are seeing the patients also.
So which branches in pathology do you think will be the future?
Pathology, I would say on medical pathology, I would say patho-oncology is one branch. My sister-in-law did that. So that is definitely one of them. Hematology. Hematology is again a part of pathology, where I think clinical hematology is another branch which many people are taking. And if you have done MD pathology, I think clinical hematology is again something which you can take in the future.
So how is the life for a female pediatrician? Do you think there is a bias in this field? And is this branch suitable for females?
This branch is very good for females, because the basic compassion, the basic nurture that is a part of every female, I think will help them a lot in this field. So there are a lot of females who are pediatricians, but I would say females pediatricians would be very, very good, because they have many of the inherent qualities which would ideally make them very good pediatricians. Very, very good pediatricians. And they have an eye for those finer details also. So I would definitely say female pediatricians, everyone would want more females to take up pediatrics, and we have a lot of them, but I would say more of females should take up pediatrics. Very good question. It should be more females who should become pediatricians.
So do you think pediatrics as a branch needs any kind of reform right now? And if any, what would that reform be?
So one reform, as I just told you a few minutes back, one reform definitely is to sensitize people more and more about the problems that they can face in the future. So that can be through different type of programs, and these programs can be put into the curriculum only, probably when they are being taught MD Pediatrics. In the first year curriculum, these things should be put. Then making the pediatricians get more and more aware about certificate programs, which are there, 3 months, 6 months programs. I think they should also be introduced. For example, we have certificate program in maternal and child health. So there you again are dealing with the mother who is immediately delivered a child. So what are the different type of things that you will advise the mother in such cases? So mothers look up to you at that point of time. So if you're not able to advise the mother, you are not just a person who is treating child. You also have to take care of the mother of the child, because if you're not taking care of the mother of the child, finally the problem will start showing in the child. So mother not breastfeeding the baby properly, the problem will start showing in the child. So that is something that should be brought in. Then vaccination, many people are following that, but I think vaccination centers should become better, well equipped. So many people who have vaccination centers, I would say some of them, I would not say all of them, but some of them are not properly following the guidelines which should be kept. I'm again not saying all of them. Many of them are not pediatricians. They are just vaccinating. Many of them are quacks also. So this awareness about properly, because vaccines have to be stored at a proper temperature. There is a guidelines of how to give intradermal vaccines, how to give subcutaneous vaccines, how to give intramuscular vaccines, and everything has a separate route. So that again is something which is very important, because you have to give properly vaccines to the child. So these things should definitely make people more, let them undergo certain programs where they are a little more calm and less stressed because they will, during pediatric practice, they will encounter situations where there is a lot of stress. So if they have to undergo a sort of a de-stress program under the guidance of with a psychiatrist, I don't think there is any problem in this, because pediatricians do get exposed to stressful situations. And when you are exposed to stressful situations, you have a child in front of you. So I think there is no harm in saying that we want a 2 or 3 months program where we are exposed to such stress, and we see how we are able to react to that. Just for example, pilots, they are often exposed to situations where there is an emergency during a flight, a stall or any emergency, how they are dealing with. Similarly, pediatricians, they should be exposed to such type of situations, or probably a case given where they are exposed to such situations, and their response should be seen. And if their response is not proper, they should be taught how to undergo a proper response. So those type of certifications should also be given. Only after that an MD Pediatrics should be complete. I think we'll make the situation better.
Thank you so much, sir, for such a compelling conversation. It was a lovely podcast, but it's not ending right now. We are moving on to our very exciting rapid fire round. So this has a very simple 2 rules. You have to speak the truth and you have to be super spontaneous with us.
I always speak the truth.
Yes. Okay, sir, are you ready?
Yeah.
Great. So what is your favorite childhood memory?
Playing cricket with my brother.
If not a doctor, then who would Pankaj Tikku be?
I would have been a doctor only.
If not Peds, then any other branch?
Medicine, MD medicine.
So what's your favorite vacation destination?
In India, Kashmir. Outside, I've been to Switzerland. Interlaken was very good.
Very beautiful.
Very good.
Biggest inspiration in life?
Before my marriage, my mother. After my marriage, my mother and my wife.
What's the most fun part of your day?
Morning, when I'm doing my exercises.
आप वैसे ही बहुत fit हो वैसे.
पता नहीं, but exercise is a part of my daily routine.
What's the last song you listened to?
Kishore Kumar song, Chala Jata Hoon. I'm a great Kishore Kumar fan, so I love all his songs.
Last series watched on Netflix?
Netflix, I do not watch much. I do watch sometimes Kapil Sharma shows, but I do not watch much Netflix series. I watch Sony and Sub TV serials once in a while after completing my clinics, but not much Netflix series. Once in a while, yes, a movie also I've seen, but I think Stree 2 I saw there, but not much of a movie buff.
The favorite dish?
Saag, along with makke ki roti.
Sir, a secret hobby of Dr. Pankaj sir we do not know about.
Writing.
Writing तो मैं पता है sir.
I love writing other than my medical things also. I actually love to write a lot, but after my practice, that has slightly reduced down, but writing has always been a hobby.
Happiest moment of your life?
When I saw I've cleared my PMT, saw that in UCMS, I've become a doctor. That was the first realization I have. It was PMT clearing, but first realization that I've become a doctor.
What was your rank?
My rank was 162, I think.
Amazing.
UCMS.
Amazing, sir.
Thank you.
Thank you so much, sir, for being a part of our podcast. Some amazing conversation,
Thank you.
and every bit was a gem, sir.
Thank you, Dr.
so
Nachiket.
much. Thank you so much for taking your time.
Thank you, Dr. Nachiket. Thank you again for inviting me, and thank you to be a part of this podcast. I always love talking to you, and similar here. I enjoyed a lot being a part of this podcast. Thank you.
So it's just the love of our audience, sir. They keep pushing me to get more people, such brilliant people. And that's the love that's making this show continue every day and now. Thank you so much, guys. Thank you so much for your love. I believe that today we have cleared every bit about pediatrics. I don't think so sir has left any part of this complete branch, and we can very well say it's a well-tuned episode. So thank you so much. Who do you want our next guest to be in our hot seat? Please write it in the comment section. I'll try my best. And one thing you can help me out is you can also message that faculty or that doctor to come to our show. We would be more than happy to host the most brilliant doctors of our industry. And before ending this podcast, do not forget to like, share, and subscribe. Thank you so much, everyone. All the best. God bless you and best of luck.